Thanks to all of you for joining today. This is a topic that affects all of us. And no matter where you are on the political spectrum, all of us want to trust that the pill we put in our mouth is manufactured as it should be. We give medicines to our children, our parents, we take them ourselves, and they better be right, every person, every pill, every time. This is a kitchen table issue, and it makes trade policy issues with China more understandable to the public. Unfortunately, most policymakers in the executive and legislative branches are unaware of this dramatic dependence of the United States on China for medicines. Doctors don't know, and neither does the public. China RX is the first book, the first publication that names generic drugs made in China by Chinese companies and sold in the US. It took 3 years of research to do this book because this information is not readily transparent. You can find out how to find out where your medicines are made in an appendix in China RX. It's also the first to expose the risks of dependence on our health security, national security, and the economy. As I'm sure a number of you are aware, the safety of our drugs made in China has been prominent in the news. If you're watching the slides, this is a cover of China RX. One of the most pronounced stories in the news with regard to China and its medicines is the vaccine scandal happening in that country. There were vaccines that were substandard and sold and used in that country, especially for children. And China has taken a very strong stance on it. According to this piece in the Wall Street Journal, 37 people have been arrested over the alleged illegal distribution of improperly manufactured and stored vaccines. This response to the vaccine scandal in China is quite markedly different to the response to the carcinogen in blood pressure medicine, Valsartan, made in China and sold in the United States and 20 other countries. And according to a German industry source, this contamination may have been going on since 2012. The response is very muted. This is an article from USA Today. The FDA has recalled the drugs. It's had 3 different recalls as it understands the depth of this contamination. To put it bluntly, it's been a slow poisoning of those people who are taking this product. It's unknown what the long-term impact is, and that is what makes this issue very challenging when our drugs are not safe. How did we get here? There's been a dramatic centralization of the global supply chain in China. It started in the 1980s, that dramatic shift. And there's a screenshot here, if for those of you who are online looking at the slides. This is from an industry newsletter. And I was researching China RX. It was such a striking headline. It reads, "Dangers aside, drug makers can't live without Chinese APIs." APIs are the active ingredients, the components in our medicines that give them their therapeutic value. And this came from 2012, and let me read to you the first paragraph. "When it comes to Chinese-made APIs, Western drug makers are between a rock and a hard place. They know Chinese oversight of bulk APIs is insufficient to snuff out substandard producers, but since China produces more APIs than any other country, they can't live without them." What we've seen increasingly is this narrowing of that global supply chain. So what of your medicines that are made in China? What we're seeing is China is quickly moving up the value chain from making the chemical ingredients to making the finished drugs. And China RX is the first book to name some of the generic drugs made in China by Chinese companies and sold in the US. Here's a few examples. Young women are very interested to know that their birth control pills might be made in China. Medicines for HIV/AIDS, Alzheimer's, Parkinson's, epilepsy, antidepressants, and even chemotherapies for leukemia, lymphomas, and metastatic cancers, and of course, antibiotics. And there's a prediction that we make, and that is that China will eventually, maybe just 10 years or less, overtake India as the leading global generic manufacturer. And the reason for that is China has the will. It has stated that it wants to be the global pharmacy to the world. It's made dramatic investments in infrastructure, supports the industry in many other ways. And so that will further narrow the supply chain for the actual medicines themselves. So how dependent is the United States on China? If China shut the door on exports to the United States within months, pharmacy shelves would be bare, hospitals would cease to function. I'll give you one example of a finding from our research. It was about a Chinese company producing active ingredients and finished drugs for the United States. The US Food and Drug Administration, FDA, went into this plant in China because of customer complaints. Presumably, these are companies that are purchasing products from the Chinese plant. They were complaining about products that lacked full therapeutic value, which is very dangerous if you're a patient with cancer or taking an antibiotic. And there were particles and other materials in some of its products. The FDA went in and ended up banning 29 products from that company from coming into the United States. But because the United States is so dependent on China, the FDA had to exempt 14 of those products from its own ban. And that includes antibiotics and chemotherapies used in adult and childhood cancers. This is just an indication of our dramatic dependence, and it's happened so quietly, and so few people know about it. So how did we get here? A turning point was the US-China Trade Relations Act of 2000 and China joining the WTO. It was fascinating doing the research to see the link between this legislation and these events and what happened within just 4 years. And this is what was more immediately transparent. A large healthcare company outside of Chicago, Baxter Healthcare, started buying a key ingredient from China to make a very important blood thinner called heparin. 3 years later, it was found to be deliberately contaminated in China for economically motivated reasons. There were official deaths numbering around 250 associated with this product. But this type of crime is very, very hard to trace. It's very hard to show the cause and effect, that taking that drug resulted in the death or injury to a patient. So we don't really know what the true death toll was or the injuries. This is how insidious and how challenging it is to have medicines that are not meeting the standards that we in the United States have come to expect. This is a clip from the heparin hearings on Capitol Hill, where family members share their stories. What's interesting about heparin is that the side effects could be immediately determined in many patients. Within an hour, within minutes even, they were suffering from severe reactions. This is different from the contaminated blood pressure medicine that we're seeing now. It's called Valsartan. And when there's a carcinogen in a medicine, that can take a long time to have an impact. And so again, the cause and effect relationship can be unnoticed and unknown and virtually impossible to trace. And this was a picture from the New York Times of the heparin making facility in a rural area in China. Globalization has been a form of de facto deregulation. Here's a couple of other events that happened within 4 years of the US-China Trade Act of 2000 and China joining the WTO. As Michael said in his introduction, the United States was instrumental in building enormous capacity to make penicillin, which was a miracle drug for the soldiers in World War II, who many more would have died because of infections from their wounds. But ramping up production with government and industry working together saved untold numbers of lives. Fast forward to the early 2000s, it became known that a number of companies in China formed a cartel, and they drove out the last US manufacturer, which was Bristol Myers Squibb up in New York. Also, the vitamin C cartel was formed in China, which also drove out US producers, and the last aspirin plant closed. This is information, this is some of the trends we could find out more readily, but I'm sure the impact would be much more widespread than this. But because these are products that we all know as consumers, they can ring true and ring home. Now here's some data showing how China's penicillin cartel equals the US, as well as Europe and even India, why we don't make penicillin anymore. This is data that comes from a trade group in Europe, which frankly, they were much more transparent and helpful in the course of writing China RX. They're called the European Fine Chemicals Group, and they make the active pharmaceutical ingredients for many, many products, the companies in this group. And look at the subtitle of this presentation that they did, a 25-year landslide in the manufacture and business of active pharmaceutical ingredients in Europe between 1983 and 2008. This is a presentation that documents that landslide, frankly, of destruction of an industry. And certainly, I think it's fair to say many trends here would parallel what happened in the United States. So here's what happened with penicillin. This is a very busy slide, but what it shows here, and for those of you who are online, the bottom line is noted here, after several years of dumping at below market price, penicillin material on the global market. It drove out US, European, and Indian producers. And once those other producers left, as competition couldn't exist anymore, there was a sharp price increase that started. Again, once China's companies gained a dominant market share in the global market. So one of the questions that comes up is, well, aren't drugs from China cheaper for US consumers? A very important message that is little understood is that we are losing control over the supply of our medicines. And when we lose control over the supply, we also lose control over the price and cost to consumers. The vitamin C cartel that I mentioned earlier, this is subject to a very, very extensive antitrust case. That could be a webinar in itself. The evidence provided in that case showed clearly of Chinese companies raising the price of ascorbic acid up to 700% for US consumers. Once they gained dominance in the market, US consumers saw dramatic price increases for their vitamin C pills. And when vitamin C goes in hamburger buns, fruit juices, and so much more, all of us were paying higher prices. But it was hidden to us because these were components, just one part of a product. So what's the economic impact? We have a chapter in China RX called the China Trap. As manufacturing goes, which we are seeing it go out the door, the loss of jobs is incalculable. So goes innovation. And we're talking not only about manufacturing jobs, but also high-paying STEM jobs. This was a tweet that went out the other day. China RX predicts that at this rate, pharma industry will be a shadow of its former self, just managing regulatory, marketing, and Capitol Hill lobbying. The heartbeat of an industry will be gone. And that was inspired by this article that came out of the Wall Street Journal this week, describing how China, to its credit, is not just making drugs developed by the United States and other countries, but itself is becoming a producer of new drug products. And this startup company received $350 million from J&J, Johnson & Johnson, for the global rights to co-develop and market the experimental treatment. And so what we might be seeing here is the outsourcing of our R&D and all the jobs and all the intellectual capability that we lose as a result. It's heartening to see. This is an editorial today in a widely read industry newsletter called Outsourced Pharma. And the editor of that publication has an incredible piece and acknowledges, quote, those US companies who think that working with China on China's terms is going to have a long run benefit might want to think again. We're trying to start a crucial conversation with China RX to point out these challenges, not only to the present, but also the future of a very important industry in the United States. I'm sure many of you on this call are aware of the Made in China 2025 initiative. The pharmaceutical industry is one of the advanced industries targeted in China's Made in China 2025 initiative. So what about tariffs? How do they, are they addressing any of this? There was a proposed list from the US Trade Representative's Office of more than 1,300 tariff lines, and they included in the proposed list ingredients and chemical precursors from China used to make prescription drugs here in the United States. But the response from the industry to the proposed tariffs was, and here's a quote from a testimony before the US Trade Representative, that the tariffs would increase the cost of manufacturing for life-saving chemicals, adversely affecting the administration's recent plan to curb drug prices. So this testimony clearly solidifies the fact of US dependence on China for crucial ingredients and components in our medicines. Of course, China's devaluation of its currency can have a mitigating effect on tariffs. Let's move now finally to the national security risks. I'm sure many of you will remember the anthrax attacks in the United States, in New York and Washington and elsewhere. The US government needed to buy an anthrax antidote called doxycycline. A European supplier obtained the active ingredient from its plant in China. And when I was interviewing an industry leader, he's quoted in China RX, he said quite bluntly, what if China is the anthrax attacker? This is another quote. The enemy was distributing viruses or bacteria to society, and it was also the maker of the drug to fight those bugs. You could find yourself in a difficult situation. And if we look throughout history, certainly food can be used as a strategic weapon, just as it was in World War I and World War II. And now medicines can be used as a strategic weapon. As you're thinking about your questions, I have a question for you. What leaders do you know who you think should know about these issues? And what's the best way to reach out to them? China RX, the 3 years of doing research, it was all done in the public interest, in the hope of raising awareness and making change that benefits the industry and the public. So now I'll turn to your questions, and I look forward to hearing from you and what you're thinking.
Thank you, Rosemary. The questions, there's a question box as I... Thank you, Rosemary. There's a question box for everybody in the what's called the Go-To webinar control panel. I see there's one question pending. I do want to give any reporters on the call the priority for questions, and I'll call on them. If you could identify yourself as a reporter, because I may not know your name, I will ask yours first. But go ahead and start typing in your questions. I'll pause one moment. Okay, the first question is by Charles Bloom. Interestingly, only one Valsartan manufacturer, Solco, was subject to the recall. The implication is that all of the producers are shipping a safe product. How much confidence should we have that other imports are safe and that the U.S. recall process really works?
Thank you for the question. Well, it's interesting that the FDA, as mentioned, has had 3 different recalls as they've come to understand which are the distributors are distributing this product. And so that presents a challenge. This is a contaminant that takes time to identify, and the FDA and presumably companies are doing testing. So I think we have to proceed with caution. It's also striking that we know very little about the contamination and what it means for those who are taking it. So I think we're still at a very early stage, and I think the lack of transparency and openness, certainly by China, to provide information about its own manufacturer is also of concern.
As follow-up, Rosemary, I think it might be good to just quickly outline, what the nature of the FDA preventative, safety rules are as applied to, China or other imported pharmaceutical products. Do they have staff on site in the foreign countries? Is it only at the border? What's the nature of that system?
Yes, beginning in 2012, with legislation passed by Congress, for the first time, the FDA had resources and authority to set up an office in China. It actually began doing so a bit earlier, right after the heparin crisis in 2007 and 2008. Secretary Leavitt had begun to set up that capability and negotiate the terms. And now a very substantial change was that companies making drugs for the United States or their ingredients for the first time had to register with the FDA. Prior to that, the FDA did not even know who was making America's drugs, where they were located, who the senior leadership role was, and their contact information. The FDA has inspectors in China, located in its office in China. It also has offices in other countries. But one of the key differences when FDA does an inspection, which is its primary mode of understanding whether companies are following good manufacturing practices, is that its inspections in a foreign country are announced. It's rare that they will do an unannounced inspection. And companies can have 4 to 6 weeks notice for that inspection, whereas companies here in the United States, unannounced inspections are conducted. And the inspections are different in a foreign country, especially in a country with different culture and language. For a number of years, China was holding up visas for FDA employees who were slated to work in the office in China, which was a significant impediment. So overall, the FDA has ramped up its capability, but inspections are not a guarantee of quality drugs. There has to be a culture that's in a country and in businesses that make medicines. And the supply chain has become so complex. While the FDA can do the best job possible, the complexity makes it so difficult to ensure that every drug is what it should be. And in this case, with the Valsartan, the manufacturer changed its process for making the product. And that's contrary to what is considered appropriate under FDA good manufacturing practices. And that's what led to this contaminant, this carcinogen, being found in the product. And apparently, was not evident in the standard tests that are performed by companies that purchase the product. The same issue happened with heparin. The contaminant totally bypassed, went under the radar of the purchasers and also the FDA when testing it. So those are some of the challenges that we're seeing when we're outsourcing to places that don't have the culture and the gold standard that the United States has had and the quality that the Americans have come to expect for so many years.
Right. So this is import facilitation. Import facilitation means you just let everything in without any kind of inspection or the same standards. It applies to many products. Next question is from Stan Sorsher. Is it likely that U.S. producers, Stan's one of our board members, is it likely that U.S. producers can restart their production if tariffs were effective to block or slow imports?
This is a dialogue that we're starting with the industry about what it would take to restart manufacturing in the US. It's certainly not easy to set up a penicillin fermentation capability overnight. That takes time, it takes know-how. The cost dimensions would have to be understood. The good news is that there's a consortium of hospitals and very large health systems that have come together with Intermountain Healthcare out in Utah leading the effort to try to bring some drug manufacturing home or to do its own drug manufacturing using capital from hospitals and large health systems, which spend so much money dealing with drug shortages that really have killed people. Those drug shortages happen for a variety of reasons. It also happens because of the centralization of the supply chain. So yes, manufacturing theoretically could be brought back. Do there need to be incentives or any regulatory changes to facilitate that? But it won't happen overnight.
Yeah, and I think I'll supplement saying that if we've looked at potential for reshoring in several industries, and if there's some expertise and capability and plant infrastructure that can be flipped from an existing product to the new reshored product, it goes quicker. If it has to be a whole new plant build and hiring employees, that's a long-term depreciable factory type asset, which you need a little bit more durability and the change in the trade relative pricing in order to get the reinvestment for that.
Just on this point, in interviews with those who actually do manufacturing of pharmaceuticals, a very seasoned individual in the industry said that I interview so many people coming to work in our plant that because their plants are closing, even some brand new plants that have been opened. So I suspect that there is infrastructure out there, and how is it that we can provide incentives to use that capability? Also, there's new technology with continuous manufacturing that can speed up dramatically the production of medicines, but it takes investments in that new manufacturing approaches, and industry has to be willing and see the financial advantage to do so.
Okay, next question is by Greg Owens. Is there anyone in Congress or the administration that's taking this issue seriously?
I'm not aware of any. There may be. I'm just not aware of any. And if you know of anyone who wants to be on this, has some inkling of it, please let us know that.
Next question is by Jim Stuber. He's a CPA member, like Greg Owens, the past question, the head of our co-chair of our Buy America committee. Jim Stuber's question: what role does the chain drug stores move toward store-branded, over-the-counter drugs play in all of this?
I think we're seeing the increased commoditization of over-the-counter and generic drugs. We're also seeing the FDA wanting to rely on more imports as a solution to the high cost of drugs in the United States. These 2 points raise the concern that we're just driving more production to China because China has the will and the resources to be able to subsidize production until it garners a larger and larger, ever-growing share of generic drugs. And generic drugs account for almost 90% of all prescriptions filled in this country. So as they move in that direction, our interest in low prices and commoditization even more could hasten and accelerate that, basically helping China take more and more of our market share.
Next question is by Vicki Davis. Have you looked at personalized medicine? Is China involved with customized medications produced at compounding pharmacies for a person's specific body chemistry?
I don't know the answer to that question, Vicki. I don't know the answer. I suspect that they're looking to build an industry quickly that takes advantage of existing technologies and markets. They may be doing it, I'm not aware of it. Thank you for asking.
China could be on deck because of China 2025, if that's part of the new horizon, I suppose. Next question is by Sarah Hall. Have you done any research regarding how much resistance to bringing manufacturing of drugs back to the U.S. there is? How much resistance there is to bringing manufactured drugs back to the U.S. and how much resistance is due to political actors and other investment in China on the part of others?
That's a great question. We're just beginning a dialogue with the industry and where they aim to position themselves. Certainly China wants their technology and intellectual property for now to build out its own industry. And companies' leaders have said that they're concerned about retaliation if they send any signal. It could potentially cut off their access to the Chinese market, which is huge and dramatic, as Chinese consumers want high quality drugs. So we're just beginning that dialogue with the industry and to understand those dynamics. And of course, they're willing to share some information, but certainly not all about their intentions.
Just to follow up with that question, there is beyond pharmaceutical products, there is now a developing track record of short-term access of U.S. companies or multinationals to the China market for some short-term profitability. Apple, of course, is part of it. Their market share has dropped significantly. They're down to 7%. But then
Right.
pretty soon you see copycat products showing up. You're less welcome. Or if you're a buyer from there, once the product is centralized there, you get predatory pricing until they drive other global competitors out of the market. And like in penicillin, then you get the predatory pricing at the low end to undercut, and then predatory pricing when they can hike the prices when they're the only game in town, like in citric acid. Do you have any sense yet whether that track record is persuasive to some in the industry that are looking into their crystal ball and hopefully beyond the next quarterly profit report?
I think there's clear evidence of that trend happening in pharmaceuticals as what happened to Apple. We saw with Johnson & Johnson, it had a diabetes monitoring product and it almost lost its trademark from a local competitor, where there were allegations made by J&J that local competitor had actually counterfeited J&J products. Another diabetes product manufacturer in Europe has seen its market share slide as Chinese domestic companies ramp up production. So I think absolutely, we call this the China trap. And I think that this industry is driving right into it. How that affects their decision to stay in China for how long. That's certainly strategic decisions that I hope are happening at the governance level of these firms. I hope China RX gets those rooms because the consequences could be quite significant for them as China seeks to displace the United States as the global maker of our medicines.
I do know that in other industries, I saw earlier this week that Lindsey Graham tweeted or was quoted as saying he's told BMW and Boeing that, look, you're having some short-term, possibilities now, but 5 years you'll see a, BMW copycat car or a wide-body plane, and your market time will be done.
Well, you're absolutely right, Michael. The intellectual property theft certainly has affected the pharmaceutical industry. Nation-state actors have infiltrated. Certainly one company is publicly reported, not naming the company, and certainly accessing not just its new R&D, but also its business operations, who its customers are, its distribution channels. And I think there's even more worrisome trends where China controls and knows the distribution channels for medicines, where they go, and with electronic records, perhaps even down to the community and even the patient. So I think there's certainly national security concerns there as well.
Right, and possibly the March 22nd report by the U.S. Trade Representative on the 301 investigation is probably the most extensive documentation of commercial espionage by a state actor that's ever been done. So that's a resource in other sectors. Next question, again by Charlie Bloom. What's the best additional remedy to reduce the threat posed by tainted products and ingredients?
I think we have to diversify our supply chain to countries that are trustworthy. I think it's going to take many, many years before China gets to that point. It certainly has some high quality production facilities, according to industry people who've been in them. But one of the things we do in China RX is we ask people in the industry, when you go to the drugstore, do you have complete trust in the products from China? And none of them gave it a clean bill of health across the board. So we have to diversify our manufacturing. And also, I think a larger issue is we need to think of our medicines not as a cheap commodity, but as a strategic asset as a country to do that. As a country, we consider oil, natural gas, and other energy supplies. We consider food as a strategic asset, so we monitor it. We monitor supply and demand domestically and globally. And we need to do that here in this country. And we also need risk assessments that are part of a tracking and forecasting system. We see private and public sector tracking of crucial food supplies and energy supplies. We don't have that. And it's no one's job in the United States to do that. And that's a huge missed opportunity. It's an issue for Homeland Security. Our military is dependent on medicines from China. Think of that, the young men and women in the South China Sea may be dependent on the adversary for their antibiotics. So I think consider our medicines as a strategic asset, and also to look at this as a national security issue, not just a public health matter where its risks may be in the future. We have risks right now.
Next question by Stan Sorsher. Europe and other countries must also be subject to these monopoly risks. Do they have responses that we can learn from?
Absolutely, great question. Other countries are in the exact same position as the United States is. I don't see any steps forward that I think are worth replicating. I don't see any.
To push it a little more, I'll ask my question. If you were Queen Rosemary of the United States, and what would you do?
I would identify the medicines for which we are dependent on China that are absolutely essential for a country to function, and to identify our current suppliers throughout the supply chain, do a risk assessment of each of those suppliers. And if we have to, as we've done with vaccines in this country, if we have to strategically provide certain subsidies or incentives to bring some manufacturing of essential drugs back home to the United States, that is something that is certainly worth conversation.
We do know that the administration, and I'm a bit surprised it hasn't come out yet, but they have been doing some sort of an inventory in that line of thinking in the defense supply chain, inventorying what's essential, where the suppliers, multiple tiers. And so, maybe it's possible to get something like that into, the chain of the,
Yes.
the work later on.
That's right. We interviewed a Brigadier General, John Adams, who did a very important study of key components in our military industrial base, for which we're dependent on China, unbelievably so. And we need to do the same thing here in this country. And I would start, as he did with the military, because the military purchases its drug products the same places that the civilian population does. So I think that would be a really terrific start. And we're in touch with those folks, but we just need to find a willing ear to entertain such an endeavor.
You know, it might be that if you put together a 1 or 2 page memo of on this topic, this seems like something, you know, it could be actionable with a willing ear. You know, send it to me. We could even post it on our CPA website. But you know, I have a few ideas of willing ears myself, so that might be something, you know, for a slow August to do.
Oh, thank you, Michael. I'll do that.
Next question by Vicki Davis. All things considered, it seems to me that trade with China is forcing our country to move to state capitalism, communism. What do you have to say to that?
I think we have still a robust capitalist system. And if hospitals are willing to, and large health systems, which are multi-billion-dollar entities, are willing to invest in domestic drug manufacturing to some degree, probably not the active ingredients, that says we could build on our strengths and let the market work. Now, if we look back at the wonderful work of drug companies here in the US right before D-Day in Normandy, that was a joint effort with government because it was in this country's national interest to do that. And we might be approaching this point with our medicine. So I have hope that our capitalist system and smart public policies can get us where we need to be, and not resorting to capitalism or state communism or state capitalism.
Maybe the better term is strategic capitalism in the national interest.
That's right. If we think about it, these are products made by private companies, but they serve a public purpose, many of them, certainly not all of them. And so we have a public interest to know that when we walk into the emergency room of a local hospital or taken by an ambulance and we're in septic shock, that antibiotic that will save our lives will actually be there. So these are, to some degree, they have aspects of public goods, not just private goods.
Right. And there's a lot of instances of that type of strategic capitalism from Japan and Korea to Germany with their national champion industries that they harness at times for the national interests, for economic or national security. And we certainly did too with our own industry in early and mid-age America with the RCAs, the Boeings, the IBMs, et cetera.
That's a great point. Thank you for that. And thank you for the question, Vicki.
Next question by Charlie Bloom. It's may have been covered, but in part. What has happened to the Puerto Rico facilities that produce substantial quantities of generic drugs? Could government support for a rebuilding that industry be part of the solution?
You're good to bring that up. I haven't followed the Puerto Rico situation that closely. What's happened since then? Those events from the hurricane season really caused a great turmoil in dramatically destroying production capability. It's worth taking a look at that, and I'd be happy to talk to you offline about that.
Next question by Greg Owens, the other co-chair of our Buy America committee. How about requiring certain strategic medicines for the military, VA, etc., are made in the USA as part of the Berry Amendment that could help jumpstart domestic production? For those of you who don't know, the Berry Amendment is sort of the Buy America procurement portion of defense appropriations. So it's sort of Buy American for defense.
That's a great question. Thank you for asking. It's also the Trade Agreements Act. Ironically, in just recent years, and unfortunately, things have moved in the opposite direction. The VA announced a couple of years ago that it was going to permit products from non-designated countries, including China, to sell drug products to the United States Veterans Department of Health Administration. And the reason they gave is that that's where commercial trends are moving. So we've given in because of trends in the commercial market.
And there's a certain logic to that, isn't there, Rosemary? Because we have our own cartels that are driving prices for pharmaceuticals up awfully high here.
China has a lot to learn on how to form a cartel from right here in the United States and to manipulate prices.
So how do you handle that tension? We've got our own cartels, the China cartels, the lack of safety there. How do you handle, how do you handle that tension? You do your sort of inventory of national security relevant medicines that we're dependent on, but then you have a risk of driving costs up here. What would you say to that?
There's been good people who are have been very concerned about this for many years. Actually, 60 Minutes did a story on this a couple months ago, and it's to take away the safe harbor provisions that allow the kickbacks to take place in the selling of pharmaceutical products. So getting rid of that safe harbor provision, which it should be a Costco model, but it was turned upside down to make it the most expensive, non-transparent means of supplying and pricing medicines in the United States. So good people have tried to do that, but it's certainly taking on very, very, very powerful interests that I'm sure you're all aware of. But there is a means to do it. And I will say this has been mentioned by this administration. It's one thing to mention it as something that needs to be done, which is an accomplishment in itself because few administrations have had the courage to even take it on. But it's another thing to actually get Congress to agree to it.
Are there any other questions? All right, so that's all the questions. Thank you all for joining us. We do periodically at CPA have webinars on what we hope are hot and interesting topics. Certainly this is one of them. I think you'll be hearing a lot more. I think we're just right on, a real upswing curve on attention to this issue with all that's going on. It rolls into so many others, but it's unique in its own way as well. So I think we're again on the cutting edge. CPA is used to being on the cutting edge of the trade and economic issues, starting with maybe a lesser popular position that sometimes congressional staffers have said, you guys are like Nostradamus, you were 5 years ahead. Well, hopefully it wouldn't be 5 years for this. But thank you for attending, and thank you, Rosemary, for your wonderful information and judgment.
Well, thanks to all of you for your very strategic questions. And I've taken note of some of them. And please don't hesitate to contact me. My email should be right up there on the screen, hopefully still.
All right. Have a great day, everyone. We'll end the webinar.